Williams, and today I'm interviewing Dr. Tiffany here at New Beginnings Chiropractic. Tiffany, why don't you tell everyone new to the area or already existing in Windsor what your practice is all about and where it's located?
So we're here in Windsor, we're right off Main Street, right next to Ace Hardware. And we see lots of pregnant mamas and kiddos because that's a specialty that I have. So I'm Webster certified, which is a technique that we use for pregnancy. So I see a lot of families. I do see a lot of dads and grandpas and grandmas. So it's not like I just see that population, but that's a lot of what we focus on. So that happens to be a lot of what we see here in the office.
What are some of the patients that come in? What kind of problems do they have and what kind of solutions do you offer? So how do we know if someone needs to see a chiropractor during pregnancy?
In pregnancy, a lot of times what moms are coming in with is issues with low back and pelvis. So a lot of the pubic symphysis issues, sciatic pain is really common in pregnancy, around ligament pain. So those are just really common things that we see. I have a lot of moms that I've seen through multiple pregnancies, so as soon as they get the positive test, they're on the phone and they're like, hey, I need to start coming in regularly or more regularly because I want to make sure that my pelvis is balanced, because that's one of the things as you have all those lovely pregnancy hormones.
Yeah, they're fun.
Everything starts to loosen up and things start shifting in ways that we don't always want them to, which can cause a lot of pain in pregnancy. But one of the nice things is as we get closer to labor and delivery, if we keep your pelvis as balanced as possible, we have shorter labor and delivery times. I won't promise pain-free, but a lot of women
I don't think anyone
easier
can promise
labors, which is of course what all of us want.
Right.
So that's really cool that there's actually research out there that's shown shorter labor and delivery, which is really awesome. But that's some of the really great benefits that we can see, and then just more comfortable pregnancies, and then easier recovery postpartum.
So you're saying,
but a lot of women
I don't think anyone
easier
can promise
labors, which is of course what all of us want.
Right.
So that's really cool that there's actually research out there that's shown shorter labor and delivery, which is really awesome, and more comfortable, not pain-free. But that's some of the really great benefits that we can see, and then just more comfortable pregnancies, and then easier recovery postpartum.
So you're saying you would want people to start coming in before they have any pain,
yes.
to kind of prevent that from
to the point where
happening.
we don't have that. Yes, because you can go through pregnancies and be, I won't promise pain-free pregnancies, but more comfortable and being able to deal with things either before they become actually painful, or just keeping your body kind of counteracting a lot of the stuff that we put our bodies through, because we're not always super nice.
Right, especially with sitting down a lot during the day, or
yes.
having to be on your feet a lot amount of times. It's kind of either one extreme or the next.
Yes. And if you've got other kids, you're probably spending a lot of time looking down and bending down and picking up kids.
We're looking at our phones,
yep,
so
there's a lot of things that we do
that are
extra hard on our bodies. With kiddos, what we see a lot of with little itty bitties, with our newborns, we're seeing a lot of sleep issues, constipation, colic, reflux, all of those things. Those are a lot of the reasons we see kiddos.
You're gonna cure the colic.
Cure is not a word that I like to use. But those moms that come in that are literally I love my baby, but I'm at my wit's end, please, you've got to make them stop crying. Or we've been dealing with this other thing, and we're hoping to avoid this medication, but it's kind of we don't know what else to do. Again, I'd love to get my hands on babies before those things get to that point.
Right, and, that makes sense.
But that's a lot of times what we see moms coming in going, please, you've got to do something. And those are fun because they're you get to change not just baby, but the whole family.
Right.
And a baby can actually sleep.
Happy baby, happy family.
Exactly. So those are really fun cases. When we work on really littles, boosting immune system's a big one because we have sixth season is, especially in the last year, has been really rough. It's you kick one bug and the next one hits. So those are, again, I'm a research person. I love it. Not everyone does, but the research has shown increase in killer T cells are like the white blood cells that fight off infections. Those increase within the 24 hours after getting adjusted. So a lot of times when we have moms that call in that are like, hey, my kid, there's been hand, foot, and mouth at daycare, and I want to make sure my kid can fight this off really fast if they were exposed. Or just any of the other, like, cough and cold bugs.
Right.
Or we've had that, like, lingering cough, and we just need to, like, kick this. Those are a lot of times where parents are calling to get their kiddos in.
So how does your practice work? Do you, like, have people come in, like, before they when they find out they're pregnant, and then kind of start seeing their children after they give birth? How is it structured? Do people just pop in, or they have to be, like, already...
So
what's the kind of process of becoming one of your patients?
The day one, we do a full initial exam, so it is a little bit more like time consuming. It's usually 30 to 40 minutes.
Okay.
On adults who aren't pregnant, we do x-rays most of the time. Kiddos and pregnant women, we don't, unless there's been like big trauma and we really want to see something. Most of the time, if there's been like a big car accident and that's a concern, kiddos have already had x-rays.
Right.
So we get those sent to us. So we do full like health history and physical exam on that day one. So that's really important for me to be able to get that history, understand what I'm dealing with, because everyone is different, and for me to go in and just kind of like guesswork or pretend everyone is the same is not really serving them.
So you do like an initial like intake and then come up with kind of like a care plan after that?
Yes, usually we talk about kind of like what my suggestion is based on what they've been through and what we're looking at. In pregnancy, we kind of look at a care plan of like, okay, so throughout your pregnancy, this is what we want to do, and it's all different for everyone. Again, there's no like cookie cutter approach with care because everyone is different. But usually we see pregnant mamas pretty regularly up until delivery.
Okay.
So again, we go off of their guest date or their due date.
Right.
But I usually tell them like, if you go 2 weeks past your due date, like we're not going to penalize you, like you ran out of care.
Oh, right. Okay.
And then sometimes we get to that like those last few weeks or that last month, and they're like, I've been coming in every week, but I think I need to come in like twice a week. Is that okay? I'm like, yes. Everyone's body is different, so we're gonna take things as your body.
So you have like more personalized care.
Yes, we try and take it as, and just kind of see what their body needs from there. But yeah, everyone's case is different, and even like if we just looked at constipation in a newborn.
Which is very common and very uncomfortable.
Yes. It's not like every, 3-week-old that comes in with constipation would even have the same care plan. Because it truly depends on their birth, their family history, a lot of things play into that. But yeah, so no one is forced into a care plan. I usually tell people that, like, you're in charge of your care always. But I'm always going to give my suggestion because, like, that's my job is to tell you what I think is going to be best for you.
And then it's kind of up to the patient to decide whether they can dedicate the time and I guess the resources to kind of make that happen.
Mm-hmm. And we have what we call a coordination of care, which just kind of breaks down the financial side of that.
Okay.
So we have like a couple different payment options that give them discounts as well.
Oh.
So that we try and work with people as much as we can, especially in pregnancy. We know that that's a pretty financially strenuous time.
Right. They're about to spend some major bucks
after
that baby comes out.
So we try and make it as doable as possible because we never want finances to be the reason they can't get the care that they need.
Well, that makes sense.
Yeah.
All right, perfect. Well, if you need chiropractic care, whether you're pregnant, not pregnant, a new little baby, a toddler, pretty much anybody that is focused on, I guess, a healthy lifestyle that want to become a patient of Dr. Tiffany's, you can reach out to her, and her office is super easy to find. It is right next to Ace Hardware.
Yes, they're right here.
Which is great. Always great to be in Windsor, where you don't even need streets. You just know Main Street and what shopping center it's located in.
That's exactly right.
Well, I hope you enjoyed this video, and thanks for watching.